I don't think that's what you're doing. I'd like to call the meeting to order. The Southern Berkshire Public Health Collaborative is coming to order. Okay. The first item is review and approve the minutes of our last meeting. Thank you, Jane, very much. Any comments on those? Any corrections? If not, a motion to approve.
So moved. Second.
Thank you. Moved and seconded. Any further discussion? All those in favor?
Aye.
Is ever out there? How many do we have on the screen?
Steve.
Oh,
I
okay.
Yeah, and Steve's a
Okay.
voting member, yeah.
Right.
So
Good.
does
We heard
Steve
that.
have to say aye?
He
Or
did.
Yeah,
I
yeah,
saw.
yeah. Or just raise your hand, Steve, if you don't want to keep going back and forth. Okay.
Okay. And because we never want to short shift our nursing, like, we've now moved them to the front.
We're to the front of the line.
Yeah. Give us the scoop.
So I did the quarterly report. You'll see for Lee and Lennox, there was a tuberculosis case for each of those in July. Those are not actually tuberculosis cases. I called the state because they never show up in my workflow. So I reached out to the state and I'm like, why was I not informed of this? And he said they did further testing and they didn't meet the requirements for a TB case. So I had already put this on the report and I'm like, shoot, I should have taken it off, but. So yeah, those are true TB cases.
So the total's 120.
What's that?
Okay.
The total events,
The total
yeah.
is 120.
Yeah. And we have completed all of our scheduled clinics as of last night. We had Morris Elementary last night. We have, let's see, for state supplied flu, we did 134 uninsured and kids under 18. And high dose, I feel like this number isn't accurate. I feel like we did more, so I'm gonna have to run my numbers again. 376.
High dose?
Yep,
Really?
I feel like it was more. I'm gonna run those numbers again.
What was the first one?
State supply flu,
Oh, right.
yeah, for uninsured and those are 18
One thirty-four.
Yep, 134. And then regular dose flu, 860.
It's expressive numbers.
And then COVID, we did the Pfizer bivalent, which was 1216.
1216?
1216.
That's impressive.
That's, yeah. And then, yeah, and then so Leslie had reached out to me to borrow some of our high dose vaccine because they had run out. So she had transferred back. So it was just a 65 plus senior dose. So it wasn't the high dose. So we did 14 of those doses.
Didn't know there was a different.
There is different. It depends on the manufacturer. Ours was Sanofi's, theirs was Syracuse, I think. So it's just a lesser dose. It was a 0.5, ours were the 0.7 for the high dose. So grand total of 2,600 doses of everything. Nice. Yes, I'm very happy with
Well,
that.
congratulations to you guys. That is impressive.
Quite in the.
I thought I had somebody behind me and I was like, that's
Who
weird.
is behind you?
Hi.
Hi, Jordan.
Oh, Jordan, why don't you grab a seat, come up to the table?
Here. I was.
Never actually met you. Nice to meet you.
Whatever.
We had expectations.
I thought you were hearing things, Ellie. I was like, oh, Ellie, always think someone's behind her.
Well, I thought I was seeing a coat that was moving and I was like, that's weird. What? And where's Jordan from?
Okay.
Great.
He's the alternate for New Marlboro.
There's some copies right here. I can send you.
We did.
What do you do with that?
Well, hopefully we're good. So I did get a phone call from, how do you say her name, Jane? Good lady from Fallon Health. Sorry?
Sorry.
Yeah. I don't know.
I didn't do it.
Sarah, right, okay. For homebound for flu.
Okay.
So I'm waiting to hear back from her. And I said, we also are offering COVID also for people that would need it. So, I've had over 30 people have done homebound
30.
requests. Yeah.
That's
So
great.
It's great.
Mm.
People are so happy. I went to a
Mm.
And this
gentleman-
is for COVID and.
COVID and flu. Yeah. And if there's, whether it's family members or, people in the house helping. I'll go vaccinate whoever's in the household, but, I would rather have them all
Mhm.
be vaccinated, be covered. We received our shipment of the 5 to 11 bivalent booster Pfizer. So we are waiting to hear from Steve Souls, from WE Voice to hold a clinic there sometime after Thanksgiving. We're gonna do a big clinic, 5 to 11, and then 12 plus offer flu at the same time. So as soon as we get that date, we'll let everybody know, and Jim's gonna put out a press release. I actually had a couple of parents yesterday ask about the 5 to 11 age group. I said, we'll get the word out when we're gonna have that clinic, so.
Too bad we can't do it before Thanksgiving.
Yeah.
Yeah,
Mm.
yeah, so he said before the weekend, he'd let me know, so we'll see. I'm hoping and praying, so we can get that done sooner rather than later.
This is not a competition, but I have to say, I was very surprised at the Alliance meeting last evening. They talked about their vaccination record and showed a similar set of charts. But at Williams College, of course, 1,200 people.
Yeah.
Wow.
Yeah.
Yeah.
They
It's
made a
great.
huge clinic,
Yeah,
yeah.
yeah, that's massive.
But
Yeah.
I mean, I have a few thoughts on, so obviously. So 134 is the, 134 uninsured people, that's.
No, that's
Oh,
that's
just total.
uninsured and
Oh,
18 and under.
okay.
So it's mostly kids.
Oh,
There are a
okay.
few adults, but all the kids 18 and under can get the state supply. flu.
Yeah, so like we don't get a lot of, with all the vaccine allotment that we had to buy, which is very expensive, by the way, we all know that. The free state supplied is very low. We don't get a lot of free state supplied vaccine, right?
So, well, because we weren't a vaccine provider last year, they didn't have any numbers to
Oh, I
base us
see.
off of. So next year we could order 150 doses
Oh,
right off
okay.
the bat if we wanted.
But in comparison to like the private purchase, it's very
Right.
nominal.
Right.
And then the high dose vaccine is very expensive.
It's like,
And that's in high demand,
Yeah.
and we were getting requests, and we just couldn't accommodate that, because like, it's a lot of money to buy
it's like
vaccines.
over $600 a box for
Yeah.
10 pre-filled syringes, where I think the regular dose is like $100 and something dollars a
Yeah.
box.
So the majority
So
of
is
our,
this because of like advertising and social media of people wanting to have this? Because I have to tell you, our doctors are, my doctor and East Mountain Medical, they're pretty low key about what they quote recommend.
The
So
high
where
dose.
is the high dose demand coming from?
Medicare might be
Yeah.
one place.
Okay,
Yeah.
I mean, people's immune systems change as they get older. And I think that there is some component of different providers not pushing the recommendation because they don't want to go through the hassle of having another vaccine to manage. And because
okay, interesting.
it
Yeah.
complicates, every time you add something, it complicates it.
Yeah.
And it's really important to,
And it's expensive. They're buying it.
Right,
It's expensive.
right.
Yeah.
But I'm interested because the public is like, no, this is what I want.
it's true.
Oh, yeah.
And so my question was more is where is that coming from? Because I'm not seeing a push from the other side for all the reasons that you have put out there, but it doesn't seem to be affecting. People are like, that,
Well,
this is what I want.
I think I mean, I don't know, because, Jill and Jane, congratulations to them and everyone that's helped support the clinics being short staffed. I mean, 2,600 vaccines in my mind is like, I would have never thought that in our first year rollout. It's absolutely amazing. And the hard work and dedication on that. But I get to the point, like what I see is like word of mouth. We advertise high dose, people go to CVS, they go to their primary, oh, we're not doing high dose. Then they make that connection and then we get then we get the demand.
Mhm.
And
And a
so,
lot of people didn't even know we existed and we were having,
Mhm.
yeah, so that's.
So that change for next year.
That will
because-
change for next
because
year. My
we'll-
thoughts on average.
I think for a first year, I think you guys did a phenomenal job
Yeah,
on getting this out.
Yeah.
And when you consider that, as you say, not a competition, but you consider that the Alliance has been doing this for quite a while now, they've got their,
yeah.
they have a bigger network to push out. So I think all in all, I think next year is gonna be, you're gonna need a bigger boat.
Definitely not a two-person vote.
well,
It's
and,
not a
and,
Bobo.
and in a lot of, and put my financial hat on, there's a lot of resources that go into pulling off vaccine clinics. It's the staffing, we had to hire per diem nurses, and I think even if we were at full capacity with 2 full-time nurses, I still think we needed per diem nurses. You know, the MRC is great, but there was limitations, and then some of the clinics that I worked, and we had to pull some of the Tri-Town guys in, and they helped too, and Pat's helped, and Ellie and tons of other people have helped. Sometimes it's still not enough. And so, but Jane and Jill have pulled together a good network of volunteers, and we'll build that base over
Right.
time. But like, we have to buy more supplies, we had to buy more laptops.
Well,
and-
also, I think the MRC has a niche here.
Yeah,
And maybe, I know what our local one is kind of defunct, and hopefully we can get that put back together again. But I would think that almost that the MRC might start cultivating help for clinics.
Oh, they
they are,
Oh, yeah,
they
they
are.
do.
we probably got 45 MRC volunteers
Right,
over.
but were they fully?
So-
Were they pretty well trained and everything? Cause
Um,
that's what I'm
yeah.
talking about, is that
Yeah,
maybe.
so we're working with MRC,
To focus-
they have a video, and we'll be working next year
Good,
um,
okay,
to have it updated. But yeah, no, MRC there are some things we're gonna work on, like, we don't have direct access to the volunteers. So like yesterday, when we did not get the numbers that we were expecting, and we had to make last minute changes, it would be better for us to be able to communicate that to the MRC than through a third party, because the tone changes and the delivery changes every time you get further away from the actual person. So we're gonna make some changes, but overall, MRC was a huge resource for us this year.
yeah, well, it's a great resource, and
Wonderful
when we
people.
first started it up, the focus was. They were planning on using them for clinics, but it was under disaster preparedness.
Mhm.
Yeah,
So the MRC kind of trained on the, emergency management side of it. That's the side that I was involved in it, and not so much on a clinic thing, so.
Well, maybe
Um,
next year we could do like some sort of a video training just for, our process is different, by the way. I'm not necessarily I'm gonna go to one of the other clinics and we'll make adjustments, but maybe a Southern Berkshire specific training
Yeah.
would be helpful for them.
Yep.
yeah, because I think I recall some of the feedback is like, like, there's no right or wrong way to do it, but like. Some of the MRC folks that work with Berkshire Regional have their own workflows. Jane and Jill have set up a different style of workflow.
Right.
And so like, oh, that's not how you do it, and so there's a little bit of a disconnect there, but I think, yeah, Hank just joined it. It's just site specific too,
Right,
well,
well, it's that we're site specific in the fact that we deal with the Alfred Town Hall, the Mount Washington Town Hall, Sheffield. And we don't have the rooms, the chairs, the waiting rooms, the bigger towns, or if you're holding it in the school, or you're holding it, so anyway, it's a good thought.
Jill, anything further?
Yes, car seat programs starting to pick up. Busy bee. Got the word out. I'm like so thankful. I've been telling everybody, if you have grandparents that need car seats, let me know. Get rid of these things. So that way, when the next grant cycle rolls around, I can, do more. Yeah, I have 2 car seats I'm gonna give away today. And I know the big hot topic is flu. So I ran the last 3 weeks, so October 23rd to the 29th. Stockbridge was the winner that week. They had 3 cases. And then October 30th to November 5th, Lennox had 5, Lee had 1. And then November 6th to the 12th, Lennox had 1.
Flu or COVID, Jill?
Flu.
Flu, oh, wow.
COVID, I'm not, COVID, that will,
Yeah.
yeah, COVID's not going away.
Well, wait until the end of next week and then you're gonna see.
Yeah,
Right.
right.
Flu is gonna go flying.
Well, we've got a handful of foodborne illness issues too, that Jill and Jane were,
Oh, yeah.
had their hands full in
Pig
a
roast.
couple towns.
Yeah.
So that's, and that's a really, put my health agent hat on, that's like a really important thing for health agents to know, and they've been absolute, because, you know, Jill obviously is on Maven, Jane's a backup, and then when we get the second nurse, will be that, but like, from a health agent perspective, I need to know like yesterday, like a foodborne illness, and Jill's been fantastic about that, she lets the inspectors know, the inspectors will go out, do their inspection, they'll give Jill the PDF report, puts it all in the Maven, the way to do it the right way.
Great, I think we have.
Yeah, I found those on the CDC website.
Yeah.
Asked Zach to put them on the Tri-Town
Yeah.
And I
website.
did send them out to the collaborative. My only other update, if Jill's done, is just, you know, we're in the process of interviewing nursing candidates. We interviewed one person the other day, so I'm still going through that process of checking references, and if this person gets to the next level, I'll talk to Pat and, you know, kind of figure that out, but we definitely need to fill that second position, and Jane and Jill have taken out a significant amount of work. So that's why we're gonna do a little bit of a breathing space to get through the holiday, and then we're gonna coordinate another big clinic. Because we still have quite a few vaccines left, which we can ship back. If we have too much, we don't go through it. I think our manufacturer allows like a 25% return with a discount. So we're not really worried about that.
Okay, opioid updates. This is probably Jane, right?
Yes, and I hope you guys don't mind. I added everyone to the opioid notes. Is that fine for everybody?
Absolutely, thank you.
All right, and I can BCC you in the future. It's just, I wanted to make sure that you all saw that you all got it, that sort of thing. I don't think I did duplicate. I know I took Rebecca off because she's on twice. And so I was like, I'm not going to give her one more email. You're welcome, Rebecca.
Thank you.
Yeah.
About 20 unread this morning.
So I'm actually going to do, so the overdose settlement subcommittee, I just wanted, there's been some discussion about the disbursement of funds, and it was basically kind of decided whether the towns decide to disperse it directly to the provider, which I think there's a lot of support for it to go to the recovery center, or if towns are more comfortable putting it into a pot and then dispersing it. Either way, we need to get that process moving. Either way, we're going to, Gary's going to need to go to each of the select boards and make that pitch. But we do need to get going on that. The money just for the first 2 payments, I believe, has to be given to the organization or effort to support people who have been impacted by opioids by the end of this fiscal year. And there is a need for that money actually earlier than that.
That
So
fiscal year in this case is October.
it's June 30th.
Oh, it is the, okay.
Mhm.
So how does that work if we're not, because we have to, it was my understanding, it said it had to go into the general fund and then we had to have an appropriation for it. So if we're not having a special town meeting, how do we turn it over?
So that's a great question. It was mentioned the other day at the opioid meeting that they thought that whoever accepted the funds on behalf of the town could appropriate. So like in a town where the town manager gets the money, that they're able to decide.
So
But-
the select board can make the appropriation versus town meeting?
And that was based on, so Andy Otteson, who's been working on this pretty heavily, and also is our representative for Berkshire County for the larger pot or the statewide pot of
Yeah.
opioids
He's with BRPC.
with BRPC. What he had been told is that whatever, and I don't have that report that I sent out in front of me, but whatever bill that was trying to get through before the legislative session was finished was not did not go through. But that, the general feeling right now is that whoever, so if it was the select board that accepted the money, the select board can appropriate it. If it was the town manager, then the town manager on the direction of the select board can disperse it. And so there's gonna be some more clarification around that. It's a kind
But
of a
in
big
neither
question.
case would they have to go through town meeting.
Well, that's,
We-
the thought was is that we didn't have to go through town meeting
Okay.
because it wasn't taxpayer money. But
We should probably, because Brandy and I were talking yesterday, because the way. Because Otis is like, because I think trying to pool all the dollars like we did before, it seems very complicated. And so like, yeah, and you and I talked about possibly Railroad Street advocating directly to the towns, which I think would make the most sense. But you and I were talking yesterday about, because Brandy already got 2 checks.
Yeah, I've got
And
3
so it's
checks.
like, does
three
it,
checks.
And I sat on one for like 2 months, which I'm like, I've got to get this
it-
turned over.
and so like,
Mhm.
I think it'll be helpful to get clarification on what Brandy and others need to do to appropriate that funding, because like,
Mhm. Is
We
that
were
something?
Prepared to do it at town meeting in May, because I turned it over to the general fund, so I was just gonna take that exact same amount, have an article from free cash
Mhm.
I have
and
to ask us.
So are you
do it
gonna,
to rural recovery, but if we have to do it by the end of the fiscal year, we'll have to.
Mike, are you there?
his living room is there.
Yeah. All right, so you know, that's something, I'll make that a priority to get clarification. Massachusetts Association of Health Boards
Okay.
gives a lot of legal advice, and I'll touch base with Andy Otteson as well to figure out if we can get a white paper for town, so it's not just word of mouth, but a white paper for someone that has some authority.
Yeah, because it, like, ours is only like $1,700 so far, which, you know, we're happy to turn over sooner if we can.
And there was clarification that it just had to be turned over by the end of the fiscal year. It did not need to be spent by the
Oh.
by the recipient by the end of the fiscal year.
I
So
see.
that's a big,
That's a biggie.
What about the reporting? I mean, is
So-
town still on the hook for reporting?
well,
Very little.
yeah. So the reporting, if you're getting less than what, $35,000
Right.
per town.
Yeah,
Because I
so-
think it starts
Rebecca, is there
with
anything else that you feel like I missed on that
registers
based on our
the-
conversation?
funds, like who did that initial,
No, I think that was the thing that that I remember talking about is
the
how
contact in.
how it's allocated, who gets to say and who doesn't need a town meeting vote.
Okay. So I'll see if we can get some sort of a white paper or opinion, either from like KP Law or Massachusetts Health Boards, or maybe even like the financial people that,
Yeah.
you know.
So if it's under 35,000, there's no reporting or minimal?
Minimal, from what I.
Minimal.
Yeah.
And it might be, I could pull up my notes.
Yeah,
but-
because when we got the PHE grant, they said it was gonna be minimal reporting and it's not. So I'm just wondering.
Yeah. So back to the committee, it would be good, I think, to have whatever the letter is and have that letter reflect support for the money to be used specifically for the resource in Berkshire County, the Recovery Center, because they really are looking for sustainability. In fact, today they have a site visit from HRSA and they're gonna have a whole workshop on sustainability,
Nice.
but they're really looking for it. They're doing great work. And so it's definitely something that was always missing that is here. There was also conversation at that meeting about really trying to figure out how to link into Lenox and Lee, because they're part of the catchment area, but because they have their own school district and because they have some systems that other parts of the county don't automatically have, and they have a population center, just making sure that we're meeting the needs of Lee and Lenox as part of our community, because they're not part of the 2 school districts necessarily. And so sometimes they don't have the same seats at some of the tables, and there was acknowledgement of that. And they like Railroad Street Youth Project is a good example, as is the rural resources that Deb Phillips. There are services that we can be provided if they want them. So
Okay, so the letter that you're referring to is the one that we were gonna do from the collaborative,
Right.
saying that this is how we had decided we thought we should do it, okay, and we're still working on that letter.
Well.
Oh, no, I'm thinking of something that, so I think we're trying to get clarification on what the process is to
So
accept
there's
the money.
two
right?
things.
Two things.
One is that we're gonna try to get clarification actively. The
Right,
second thing is it would be nice to look at the letter that was asking, giving towns the option to consolidate funds and
Oh,
maybe word craft it into a
oh,
support.
their letter to the towns,
Our letter,
our letter to the towns.
basically saying we're supportive of rural recovery or
Right.
the recovery center.
Oh, I see. So yeah, we still have that draft. We haven't
Right,
met
we haven't
because
finalized that, that's why I was getting to.
we're-
You know.
where we left that, because it was Ellie, Pat, me, Rebecca, and Gary.
Right, this was my
And
bid for the-
initially, the collaborative was gonna put its own ask together
Right,
that was gonna be
right.
given to each select board advocating.
Right,
And then Gary said that at one point, he said he couldn't ask for finances. Now
right.
that's changed. And
Right.
then you and I spoke, and said, would it be easier if rural recovery had their own ask? But like, I guess we can,
Well, we
what's,
would endorse that.
so let's
Right, yeah.
let's reconvene that subcommittee after
Okay.
Thanksgiving and get back on
Okay.
track now
Okay.
that clinics are somewhat almost over, except for like one
Okay.
big one. Okay.
All right, great. So the second thing is, the town of Northampton has a resource of these opioid rescue kits. It sounds like they're like maybe this big. And they have naloxone in them, they have the breathing, the rescue breathing, as well as some other resources. And so they are willing to give us 10 to 20 of those kits in South County. And so I'm working with Gary to come up with a list of 10 to 20 priority sites. Rebecca, I would love your input on that as well. Like, and so if we can give them the specific site, who's gonna be checking it, which we have some ideas about that. And then how we're gonna refill it, which is not gonna be an issue. Then they are willing to consider giving us 10 to 20. So I would suggest that we get a list of 20 sites in southern Berkshire County. So obviously, some of them would be in our towns, like our population center, but like other places like New Marlboro, like places that are that have events.
Mm.
Right, that doesn't have good EMS access or immediate EMS access. So that there's the kits, but then we can also go ahead and the recovery center is willing to go out and give the training, and then we can just leave Narcan there. It's not in the fancy kit that hangs on the wall, but have it there for the guests or the staff, and then eventually the whole thing is trying to normalize Narcan, and so eventually you'll be seeing it like in public restrooms, like and so this is kind of the beginning parts of that. So if you have your town that you feel like there's a place like in Otis, for instance, or Sheffield, or any of the towns that that might be a priority site that the EMS is going to have a hard time getting there, or they have high risk events like weddings, then please get that information to me, and then we'll be sitting down and prioritizing those sites.
Right, and however many you come up with, some may decline, so you do need more than.
And maybe we buy things for those other sites, right? Like, and some of them, the rescue kits might be really appropriate. And other places, maybe another
Just a
thing.
basket with Narcan in it, somebody had said
Mhm.
at one point.
Yeah. Rebecca, did you have
Can you say again where? Did you say the city of Northampton?
Northampton? Yeah.
That's so they're just gonna give us,
Yeah.
that is incredible.
Yeah.
And it's a good idea to do the reporting, but do you know why they're putting that?
Probably because of their funding. They have to be accountable of
So
where
they're-
they're putting them.
Okay, so they'll say.
Yeah.
They're giving.
they probably got a
Yeah.
huge shipment as the colleges.
Yeah.
Oh,
No.
yeah.
And also like the new Fairview Hospital is Dr. Elliott from Fairview is very supportive of this.
Yeah.
Even in Fairview, if you have an overdose in the lobby of Fairview, before they had access to like this type of thing, there was a process to get it from pharmacy to. So even at hospitals, there's extra steps that, and like, when you have someone who's has suppressed or no breathing, seconds count, so.
That's right.
Yeah. So that's that. So the committee is going to meet and after Thanksgiving, and we'll have some sort of a support letter, and I think we'll move forward on that to get clarification to the towns. So that might be able to be packaged. The prescription disposal. So now that the community eco power plant in Pittsfield is closed, I don't know why I didn't put two and two together, but there's nowhere for all of our police departments. None of your police departments probably have a place to put all of those lovely prescriptions that they're collecting. So I have contacted Covanta, spoke to, there's some hangups possibly with Covanta, like, I don't know if you were part of that they want things packaged a certain way, or so we're trying to get logistics for that. Their Fairview deactivates their prescriptions, and again, we have to find something that works for the police departments. They do not want to be pawing through prescriptions, and you're supposed to remove the label, so there wouldn't even be an indication of what it is. So
They said you could all dump it all in the same bag.
what?
Originally with the prescriptions, if you have prescriptions that you want
Yes,
to get rid of,
Yes.
just take a Ziploc bag and dump everything in and then just
Yes.
bring the bag. How the heck does anybody decide what to do with that?
We had somebody do that in Lee and leave it right inside the door of town hall. A huge
But that's why that's what they were told to
Like
do.
after hours.
But I don't think
like
that's an issue.
walked in and grabbed it.
I don't think that's an issue. I think when you're talking about sealing, a lot of it's the sharps that they want those containers sealed up correctly. Like if people bring in, now I used to do the one for Lennox once or twice a year. And if people came in with just their needles, it was like, go home and get a Tide container, put them in the Tide bottle, then tape them up, then bring them back. Then I'll take them from you, but just don't go handing me used.
Yeah, well, and you're both right? So the sharps container disposal, well, we should be getting our shipments. It's been shipped. And
We have
the harm reduction van, this is new possibly to ever, the new harm reduction van is willing to give us our initial an initial amount of sharps containers, so that when we roll out our program that we will get free sharps containers. We just have to tell them what size. So the next steps on that are working with the well, I think we should work with the 3 towns are getting it, and then also check in with Sheffield to see if they want new signage. And then when we roll it out, it's just really important to roll it out in such a way that no loose needles, giving free containers at least to start. And we just want to make sure that we're rolling it out correctly.
And we gotta send up our vendor for Tri-Town because our sharps are overflowing. So we have our sharps container, but it's not in operation yet because obviously we don't have the service, so we have to figure that out.
Rebecca?
I just want to second what you said about it being such a intricate, precise process of collecting used or old medication, unused medication, because it really just has to either be a catch-all that somebody takes away or brings to an incinerator. I mean, I know you have probably spoken to a number of police departments, and they're all going to say the same thing. They don't want to be responsible for monitoring what goes in. Because it happens that people bring sharps and put them in the unused medication box, or people just dump their pill bottle or packet, and none of that will dissolve or be rendered inactive by the solution if there's plastic or other materials in there. So it seems like the two options on the market are not what the police department would prefer, and we want to really make it easy for them, or they're just going to police programs.
Yeah. So the alternative is there's mail back. I used to carry it with me in my bag, but I stopped doing that. There's a mail back envelopes that we can get for free, that at least in the meantime can be in the lobby, and people put that in there.
They
Put
put
it in-
like their bag of pills and then put them in the.
And then they put it in
And
the
they
mail.
ship it, right?
Yeah. So in the meantime, what I'm gonna try, see if we can get a bunch of those and then distribute them to the police departments. And I would be going through each individual health department and police, like there would be a conversation at each town with the health department and the police department to see if they would be interested.
And that, thank you, that's awesome. That reminds me of a conversation that we had way back when with the Southern Berkshire opioid working group about trying to get pharmacies to take back medication. Is there any way we can bolster that conversation again at that
Mhm.
working group and see if anybody had any
That's a great idea.
or light bulbs in the last 6 months about, I mean, I remember, what's her name? Jessica.
Melinda?
Jessica was like really good, how, the one that works at the place on Park Street.
Melinda's?
510
Melinda's,
or-
yeah. She was really gun ho about getting the pharmacies to take back medication, and
The problem
I don't
with
know
that
if she-
has been the corporations that own the pharmacies will not take the responsibility.
I think that there might be a Massachusetts law on that.
I can chime in on that one.
Yeah.
No,
No, there
because
isn't.
I actually, so it's a couple thoughts before I forget about the drug situation. So like, I like the bag idea, you know, can we purchase bags for the public and we can post them at town hall? But a couple of thoughts I'll just throw to the collaborative and we can think about it later is what comes to my mind is like, all right, so if we set up this process for this Cabanta out of state or find an incinerator that's willing to do that, understand what that protocols are, then figure out, then I could reach out to like Smitty and others and say, are there grant dollars for us, for the collaborative to run a program? We would coordinate with South County, pay a sheriff or whatever, you know, we call it there, the detail. And then the collaborative kind of manages that on behalf of the towns and take the burden off the police departments. Obviously, that's further down the road, but we come up with our own program. Maybe there's some grant dollars out there, maybe there's not. And that's something that the collaborative burden takes on. You know, you do it quarterly or twice a year and you pay a sheriff a 4-hour detail and gas and bring it to an incinerator. It's something, think, you know, long term, we have a lot going on and we gotta fill positions and
I don't
stuff.
like a hazardous waste.
They're out, they're either, they
There's
got,
one in Bristol, Connecticut, and I think the one in Springfield also closed down, so.
Yes, it did.
So that's like a 2.5 hour drive one way.
So Bristol is from Great Barrington, it's only a little over an hour. But Bristol from Lenox is farther, right? So it would be a day of someone's time.
well, of course, yeah, and also too, you know, incinerators are becoming a thing of the past in the Commonwealth. Because I meet with DP once a month and we talk about certain things and whatnot. And so like, that's a problem with prescription drug take back programs. If we're going away from incinerators, we need to talk to our delegation on what can be done at the state level, if there's a law or whatever. I don't know what the process is. I don't know if it's a DEA thing or it has to go to an incinerator, but we need to be advocating to our delegation that this is a problem. And if we're going to advocate to collect prescription drugs in the police departments, we're losing the resources to figure out how to do this program. So that's a conversation we can have with Smitty further down the road. And then getting back to the pharmacies, I tackled that issue many, many years ago. We actually worked with Smitty in the delegation. We were trying to pass local regulations and advocate for state regulations about requiring whoever provides vaccines or whatever be required to take them back. It went nowhere. But there could be changes. I mean, we could reach out to the pharmacies, but my conversations with like CVS, Walgreens from years ago, they were like, we don't have the staff, we're not taking that on. People are gonna just come in and gonna drop it off, and it kind of like went nowhere. But it doesn't hurt to revisit.
Yeah, well, and I know Jennifer Kimball was able to get CVS in Pittsfield
Flint's.
and Flynn's
Yeah.
both to do it. So it's. So,
I just went, I went to Big
What's the
Y,
purpose?
we spent some time last year with them, with Big Y in Springfield, and they are absolutely not
Mhm.
Yeah, it
Well-
was interesting.
Well, it's the same principle. We went through that years ago at Tri-Town. We just didn't have the resources, the room and the capacity. And like, what happens if there's a needle stick? You know, someone brings in a bag off the street and, you know, I've warmed up to the idea and Jane did a Jedi mind trick on me to get a kiosk and Tri-Town approved that. And so my mind's changed over the years, but I'm still afraid of someone walking into our building and dropping a bag.
Yeah.
Mhm.
You know what I mean? But it is what it is. It's a harm reduction strategy
Well,
and
and with the needles now also though, like you can buy for a little bit extra, you can actually buy a thick receptacle. So it's going in the mailbox into like a contained whatever. You just put the lid on. You don't even look at it. You just put the lid on, you put it in the, and then they come and pick it up.
yeah, no.
So our provider is actually really easy to deal with. So we're gonna be getting into that. I would say probably the earliest that we'll roll out something would be January, because I want to do it right. We want it to be a good experience for everybody. There's and it will be Sheffield, Great Barrington, either here or at the recovery center,
At the recovery center.
at the recovery center.
We have another one from the Alliance.
Yeah,
That potentially could be here or anywhere else. But
yeah, or maybe at
The
the
new
senior.
one is gonna go to the recovery center.
Perfect.
Yeah.
So possibly two in Great Barrington's and then Alfred.
Okay.
One
so
other
that-
thing before we move on that, maybe this is for Jane's benefit or. But I did talk to Advil Waste about their sizing for the solution. And the biggest barrel that they offer is a 30-pound barrel, which could fit, I think I have it in my notes somewhere, but 90,000 pills. So, and that's $800. So it's not a sustainable option, but for maybe it won't work for Great Barrington, but for the smaller towns, just getting rid of the supply that they've accumulated,
Mhm.
maybe that's the way to go.
Hmm.
Great Barrington has like 300 to 400 pounds at the moment, so $800 for 30 pounds really won't. It's very,
So I wonder if
Very hard.
if we can get some money, if we can find money, which like Fairview, for instance, has their public benefit dollars. This is exactly like the type of project that we could pitch, just to get everyone at reset level. And then also, I think it would be goodwill, because again, we don't want the police departments to be like, they don't have time for this right now. So,
And you don't want to, you don't want to stress them out and say, we're not collecting anymore.
yeah, so,
something that Paul keeps reminding me of is just that it's a big liability for them to have so many narcotics.
Yeah.
in months,
Oh my
and
God.
they want to get rid of it fast.
Yeah.
Well, we run the risk of them just being to a point where we're not going to collect it anymore. We don't want that to happen either.
okay.
Yeah.
So Rebecca, because you've done some great legwork, I'm just starting in, but have some resources that I think we can bring to it. Do you want to maybe meet and like, see if we can get everything a clean slate before
Yeah.
Before
they throw their
2023.
Hands up in there.
Yeah, okay.
Great,
Nice.
Very
Great
productive.
work, everyone.
okay. Topics for discussion, DPH capacity assessment update, which we're all excited about.
Really? I mean, Mike's on the call, but we're pretty close to being done as a collaborative. I know, the state offered some resources for,
Absolutely.
and I don't know who's left over. Some towns didn't have to do it, some towns did. I helped 5 towns do it. It's not an easy process, but we understand the light at the end of the tunnel and the importance of that. Heather did a fantastic job pulling that kind of stuff. Takes a little bit of time, but the deadline was last Friday, I thought. But
Well,
the DPH, I think with our shared services call this week, they have resources that will actually come out and help the
Right.
town scan, poll, whatever, which wasn't offered when I had to do it all and Jane had to do it all.
so, and I think the important thing more than like the deadline, because it has been, now they're providing support. And so now they don't have a deadline.
Yeah,
But here's the thing to remember is that as soon as we are completely finished with that, I got a private message confirming that once they get all of the towns in, then they can start the process of determining the needs. And so the quicker that we get it in, the quicker that that they will look at it and decide what it is what holes are in our Swiss cheese, you know?
Our collaborative talks, yeah. What Jane's referring to is like our collaborative. The sooner we get done, the sooner they can assess the resources and needs for our collaborative. They don't care about other collaboratives, whatever. We didn't want to be penalized if another program hasn't even started yet. So like, the sooner we can wrap that up. I mean, it's not that bad. It asks for specific things. It's about your records retention process.
Right.
And so, you know, but one of the things that I realized for a couple of towns that I assisted with, there were just some records that we couldn't find, and we just explained. You know, I'm not going up into the archives in the attic to look for a frozen dessert sample from, I don't know where it is. And, you know, like, we're upgrading our permanized system, for example, when those lab slips come in now, we have a process, we're gonna scan them and add them to the permit. But the majority of the Tri-Town stuff was all on our permanized system, but it just becomes a pain because I had to download it, name it, upload it, but.
So they're doing two things now.
Yeah.
One is that you can get all of the pieces of paper, label them, and just scan it all together.
Okay.
And mail it in. So that's like so much easier, right? Or like, you're like, okay, here's, you know, Joe's Diner for 2018, 2019, and 2021. So you just scan the whole thing in Joe's Diner. Or if you're like, here's all my food things, and you can email it to them and they will put it in.
Oh, that's not better.
That's a lot better. They can also, and the thing that I have found most helpful is, and I talked Ellie off of a ledge.
I was just gonna say, I have to officially report to thank Jane and the collaborative for talking me off the ledge. Because at that point, I was involved in 2 court cases and had everybody screaming at me, and I was like, really?
I don't have time for this.
Really?
So I'm
But
like,
we
Ellie,
did,
if you
and we
look
got
at
it done.
here's, oh, that's it. Oh, I can do that.
I didn't exactly say that.
Well, it wasn't cloud. And it was done within 2 hours.
It was done within 2
So,
hours.
so if you're feeling overwhelmed, one thing I can do is just go on and give you a bullet pointed list of what to upload, and then, anyway, so there you go, that's my pitch on
And
it.
when you get to the tobacco piece, it's gonna ask you for inspections from certain locations. Just shoot me a text or an email, I'll get them to you as soon as I can, because all the tobacco stuff's on the cloud. I can access that relatively quick.
So this was something that this really hit me, is what's the best way for us to actually be keeping these, in what categories? Is it like best to have like Joe's Diner 2018, YMCA Camp High Rock 2018, 2019, 2021? Or is it food inspection, camp inspection thing? Because
I have an
that-
easy answer, Ellie. Let's get through the capacity assessment, pray to God that Mike, we get thousands of dollars, like 6 figures plus. We put everyone on an online permitting system and you don't ever have to worry about it again.
Yeah, I don't think that's a discussion for solving right now.
No, it's not
but,
to solve it now, no.
But that is something that really came out of this.
Of
was
course.
how-
That's the whole point.
Exactly.
You know, like Monterey had 5,000 files, and like it was, when Peter was there, I'm like, I couldn't find anything. That's the whole point, right?
Right.
It's almost like the worse you do, the better resources we're gonna get, right? Towns don't have admins, don't have inspectors. The long-term goal is you get everyone, I mean, on an online system, but like Otis and Monterey didn't go online until 2021. They weren't on in 2018.
Right.
But in perpetuity, like the goal is you run a search and it's all right there.
Yeah, and the other thing to remember is that DPH staff are not looking at these documents. They I believe know which counts are finished, but they don't see the results of the documents. They are the subject matter experts who are not part of DEP or DPH anymore that are making the recommendations, and they are people who know, you know, I'm sure Paul Hoffman is one, for instance. Do you know what I mean? Yeah, and so Paul Hoffman knows what a good inspection form looks like, but he's not gonna say to Deidre, like.
It's
"Oh,
not an audit. It's not gonna tell you you're doing good or bad. Like there's things that I couldn't find, even for Tri-Town, like skip. And I just give it, look,
Ooh.
we don't have these records.
I will tell you, when you do it, you have, if there's nothing, you still have to
Yeah,
press
submit,
submit.
yeah,
You can't say skip because otherwise it will still be incomplete.
yeah.
Right, and that was for me, I couldn't get it to complete because I didn't realize I had to submit my name.
All right.
All right,
Okay, enough.
Next thing.
Enough.
Mike, did you have anything to add with respect to the capacity assessment before we move on?
Yeah, just so you know that it's maybe a little further along than what you think. They've begun to crunch the first 2 rounds worth of information at this point, and they are pretty much up to date, believe it or not. They're moving that fast that everything that's coming in, that they're probably 5 or 6 days behind for the entire Commonwealth at this point. So they're moving very, very quickly. Very quickly. The one thing I did want to throw at you, when you had the discussion about the opioids and the Narcan, the whole program is designed on a grant that has been around for a while, and I'm not sure if you folks have the MOPSI and SAPSI grants in your groups, but the results are so stark that the city of Lowell, which everybody will acknowledge is probably the worst city or town in Massachusetts when it comes to statistics for substance use disorder. In the city of Lowell right now, fully 1/3 of the rescues that are made of people who are overdosed are by casual passerbys that happen to have Narcan in their pockets. And by the time the ambulance gets there, for 1/3 of those cases, the people have been revived by somebody who just happened upon the scene or was there to begin with. You know, there's always that aspect too. So it's so effective. It's so effective that it's, you know, I just want to throw that at you because I think that's an impressive statistic. But no, on the capacity assessment, they're moving very, very quickly. Some of the towns and cities already have sort of highlighted and that they're in extreme need. We have one city with 80,000 people that it turns out hasn't done a restaurant inspection in 2 years. Not one. So
Yeah, I
Yeah.
mean, yeah.
So, all right, thank you, Mike.
Thanks, Mike.
What's our sustainability subcommittee? What's that?
So that's my sort of ask for the collaborative, you know, maybe like after the holidays. I'd like to be like a small subcommittee to start thinking about sustainability for the collaborative.
Okay, that ties into something that I want us to be looking at, which is a report quarterly, perhaps on the budget.
Oh, yeah, so there's we do a quarterly expense report with PHE funds, and I could send that out every quarter. And it's
Okay,
no big deal. It's just, I like to be mindful because it's got every single payroll for every single employee in there. I know it's public record, but as far as the other sources of funds is, you know, we need to talk about that too, because the goal is.
you'll have insurance money.
Well, yeah,
Eventually,
eventually,
yeah.
that's that we gotta, that's part of the sustainability conversation, right? It's like, but one of the things that comes to my mind from a sustainability thing, because I put in my financial Tri-Town hat on is, you know, like the goal would be to capture the annual VNA Alliance dollars to comply with supplanting of funds,
Right.
but and it's just my idea, but like, we should use that annual allocation to purchase our vaccines because they're very expensive.
Mhm.
And then as we start to get the administrative piece comes in, which we don't know what that looks like yet.
Right.
Just say, for example, argument's sake, we get $100,000 in admin fees. You use that money. It's not going to be the same every year, right? We don't have COVID and there's a low number next year. It's going to be volatile. So you don't want to use that money for like the major core things because you're always counting on that money. But if we get $100,000, that can be an administrative assistant, that can be another inspector. Notwithstanding, we hopefully get capacity dollars to make Jane full-time And obviously, I think we need a full-time inspector for some of these towns, to be honest with you, and then you take that, whatever admin money is, and that's additional programming, paying for the incinerator things,
Right.
permit eyes, other things that will benefit the entire collaborative. And so those are thoughts and ideas, and
That's part of the sustainability.
it's part of the sustainability thing. And I think once we gotta make sure all the towns are paying their, and I'm working with Ellie, because all towns are paying into the collaborative now. It's a special revenue account, doesn't go to the general fund. We've been using that to buy vaccines. We had to buy another refrigerator,
Right,
overtime for TV and supplies and travel and per diem nurses. Like, we're spending all that money for the best interest of the collaborative. And so we want to start thinking about when that admin money comes in, how we're going to utilize that in the
Right.
best interest of the
Okay.
collaborative. So I want to pull together a small group.
okay.
Do we want to, and then do we want to have a discussion on who wants to participate in that now? We want to bring it up maybe next month.
Well, I think to plan ahead and get a meeting scheduled, probably should figure out now if they're willing victims of.
And maybe some other people, because I know I want you,
Just showing up for the open.
I want to make sure it's a different group of people. It's not the same
Right.
people all over again,
Right,
but
right.
obviously.
Now you interested, you've been very quiet. I find.
You might want to just go back in the back seat.
Maybe, yeah.
I
Yeah,
would be interested in the sustainability.
Okay, good. It's sort of jumping in at the deep end perhaps, but it might be a useful exercise.
Yeah, I mean. you
Cool.
Have to talk with Scott. He's an uncle.
Yeah. And part of this is like, some of us are very used to dealing with finance committees. Like I deal with finance, it's part of that overall concept of us all growing.
Right.
Do we want to look at fees down the road? I know that's a hot topic for each town, but like, because hopefully we're getting capacity dollars, right? We're getting PHE dollars. But there's still going to be things that we want to deal with that we're not going to get
Right.
free
Okay,
money from.
right.
Yeah.
So we've got 2 volunteers, one of you will
Me, obviously.
participate in that. Is there a,
I'll participate in that.
great, okay,
All right.
Rebecca, so is that
Awesome.
enough?
Yeah, no, yeah, we don't want to
Okay.
quorum, so,
Great.
yeah.
Great, good, thank you. Jane, are there more things on your list? There are, no, or?
Oh, I do, yeah,
You-
so Monday, we're, because of all the things we've accomplished over the last year and, in recognition of all the hard work, I've invited the board membership and the staff to a small get together at 2:30 at Mosley. It's sort of my give back to everyone's hard work and stuff, and just to, celebrate, the ups, the downs, the barriers. Some of us cried, some of us were screaming, and just, what Jane and Jill and all the volunteers did, getting through this first year is, I have no words to express. It's something I want to just offer people. And we thought about a volunteer recognition, but there's like 50+ volunteers, and I can't afford to flip that bill for like 75 people. So my thought is, after Thanksgiving, in between Thanksgiving and the holiday break, is we're gonna ask all the volunteers to maybe come down to Tri-Town, do like a pizza party. And I'll invite all you up to that as well. And it'll be a little bit more manageable, having like 75 people at the early building. So it's sort of like my contribution back to the collaborative, and everyone's worked really hard.
I can bring our axe throwing set up from the farm.
There you go.
Got us to Monday. And I have a throwing knot set.
Okay, so but you just dealt with both of those topics, the appreciation and the volunteer recognition, am I correct?
Yeah. I'm all set.
Okay, good. Community partner updates. Anybody have something they would like to share?
I do.
Okay,
Is that okay? Anyone else? So there will be the housing code training, but I will tell you a couple things. One is that the new housing code is going to allow for alternative housing, so like tiny houses, or other living situations. It will allow boards of health to waive requirements in the housing code, including electrical, sanitary sewer. Well, you can have a composting toilet and you can have, so it's gonna allow the Board of Health to make these decisions, not
Great.
temporarily, but it actually gets filed with Registry of Deeds. So, what I am throwing out there is that, one thing is there is a lot of people who have nowhere to live. But there's gonna need to be some sort of meeting at the minds of town officials, because who want the best use of their property for taxes and blah, blah, blah. People who have nowhere to live and boards of health, because what we want to avoid is like a blind situation where the board is being asked to approve an alternate situation with that's not allowed by zoning in the town. We are not the zoning enforcement officials, but there's got to be a way for us to navigate this. And in my opinion, also advocate for good situations to give people a place to live. Because it turns out being homeless is not very healthy.
No.
Yes, Rebecca. Yeah.
So I only had that one brief 45-minute review on the proposed amendments. But my understanding was that it's for owner occupied homes to have those utility requirements waived. So I like took a sigh of relief on hearing that, because that to me meant, okay, these are people who are maybe in the survivalist prepper camp or whatever. They have their own resources. It's not homeless people who are under-resourced being subjected to tents or trailers. So it's not like a mass housing encampment. It's like people who just want to be left alone and have the resources to make that work, and then can also file it with the Registry of Deeds. Was that your understanding too? So it's good in one way, but also maybe only just will scratch the surface of adding to the housing stock. Is that
Well,
your interpretation, or were you a little bit more?
my conversation was with Charlie Kanicki, that's where it's like so I think that I'm encouraging people to go to the housing code training.
Okay.
Because I think that we need to talk about this.
So where is it? Is it online?
It's online, November 29th. So if
Right, and it's also something that a discussion between the collaborative and the Alliance is looking to offer, and I guess it's really the Alliance using its training hub money to offer a series of trainings on housing. Sort of a 101 that anybody could participate in, and then more sophisticated one for actually inspectors, or again, if you wanted to go just to be short, because you end up with the appeals in your lap as the Board of Health. But that's something that the Alliance and Collaborative have been talking about together, as well as a resource letter that Jay put together.
There's a couple things going on, because the Alliance became the training hub, and DPH hasn't given them any direction. They're sitting on a lot of money. One of my suggestions, like, well, one of the things, train people how to file a housing court complaint. We talk about roles of boards, agents, and whatever. Like you and I talked about this, like my boards of health don't typically do inspections, but they've gone out a couple of times. I've trained them, I've offered, but their role is a little bit different at the board level and is on the inspector level, right? If there's an appeal and whatever, but there's a multifaceted approach to do like a training. But then there's other conversations going on too, because with the housing code changes, housing's getting more complicated. There's a massive homelessness issue, lack of shelters. And like when we used to do condemnation orders years ago, and we've done a handful here and there. Now it's getting more complicated because it's like there's nowhere to go. There's no backup housing. And like, so we have to enforce the sanitary code. But I'm trying to, in my mind, I'm trying to figure out resources, and I have some ideas I haven't really spoke about yet, but just trying to update the resource list. Tri-Town did something many years ago, pre-pandemic, it's out of date. So like when we used to go out and do housing inspections, we used to hand out resource guides on like mass housing, LIHEAP, all these other so on. And like we have a situation in Lee where someone's got a rental and it's a failed septic. Mass housing now has low interest loans, of which I wasn't aware of. It's kind of things like that. He's trying to keep things up, and I also have some long-term ideas too about developing an app for inspectors, so that's later down the road.
Yeah, so this.
Can I just add one thing here for a second? I've been watching this thing and I've been sort of at times saying, I'm not sure I even belong here right now, but I think I do right now. I know why the Lord put me here for today. We got a text message last night. And it comes from Paul Halfman, and I'm going to read it to you. Hi, Cheryl. I'm not sure if you are aware, but DHCD has filed and attached emergency statute to the budget that, if signed by Baker, exempts all homeless shelters from the sanitary code and prevents boards of health from enacting requirements stricter than the sanitary code for homeless shelters. They are trying to erode our authority. I know this wording is all wrong, but you get the idea. I guess this means that those who are without a home can stay in places that are not up to minimum standards for sanitary conditions. I know that we have too much on our plates now, but this seems in contrast to providing our goal of securing equitable public health services for residents of Massachusetts. And then moments later, just heard that they want to add that they want to use hotels and motels to house homeless and exempt those too. Looking ahead, I wouldn't be surprised if they use this as precedent to get housing authorities exempt, since they fund them as well.
Yeah.
No one at EPH or EHS has the courage to oppose this.
Wow.
No,
So
there are no homeless shelters in South County, which is not necessarily a good thing. Like, we should have a homeless shelter.
Mike,
Yeah.
what happens if someone's they own a lot and they got a tent on their lot? There's no well, there's no septic. Like, would that exempt them, or we just talking about specific homeless shelters?
I think they talk about homeless shelters and talking about hotels and motels, but where this could affect you and you're not thinking or seeing it yet because it hasn't hit your part of the state, is when they start to resettle more and more of the immigrants, and they say, hey, look at Western Mass, we get all this territory, we haven't even touched it yet. I'm dealing with 3 collaborative groups right now that are overrun by this issue of resettlements. And keep in mind, I'm the shared services coordinator for Martha's Vineyard. So I've been watching this since it began.
Well, there's a huge encampment, and I live in Pittsfield, and Pittsfield Health Department's got a massive problem. There's a massive encampment at Springside Park, and it's getting bigger and bigger by the day. And they had a huge fire, and that's what's happening. People are just squatting. We had someone living in our building that had to be kicked out last weekend.
Yeah, well, if you check their passports out there in Pittsfield, you'll see that a lot of them have come from Boston.
Mike,
Sure.
do you have any context that you can share for why the HCD sent that letter?
We don't know anything more than what I just told you. We're going to be getting together later today and with the Coalition for Local Public Health, probably on Monday, to see what we can do sort of on an emergency basis to figure this all out. It just hit us last night at 7:33 while we were doing our seminar. It came in while we were doing the seminar.
And then do you have a temperature reading for if that bill will be signed?
Well, we can't figure out what it is right now. And we've got MPHA looking at because the supplemental's already been done. It's finished. It's signed. So we can't figure what bill Paul's talking about. So I think Cheryl is getting back with Paul, and Omi from MPHA is looking into what other bills could be floating around that this might get tacked onto.
So, that's what they're gonna do. They're gonna put it onto something that has absolutely no relevance. So people don't
high
see
chance
it.
they're passing, right?
But the thing is there are people without places to live, this makes me feel sick, because then how are we supposed to but on the other hand, being homeless really is unhealthy. So I don't know, it feels like there just needs to be discussion instead of a
Mandate or something.
or backdoor things are not going to work, because there needs to be open discussions about how to solve this problem and how to be flexible without like throwing out the baby with the bathwater.
So I'm assuming you'll keep us informed in at least a general way as to what happens.
Yep, we will definitely. You'll be hearing more. As Rachel Maddow says, watch this space.
Right. Okay, any other community partners? I have one on behalf of Volunteers in Medicine. We received or were included in a very large Department of Agriculture grant to provide $600 stipends to farm workers and meat processing employees. We don't have any meat processing plants in this area. But we do have some very large dairy farms in Connecticut, just over the border. There may be other seasonal workers who come in for picking of vegetables or harvesting other things.
Cannabis, would it?
No. And I mean, to my knowledge, that is not one thing, but I will raise that question.
Because there are a lot of seasonal workers that are coming in for cannabis.
Right, that's a very interesting.
How big of a farm are we talking about? Something?
It could be
like
one
Woven-
person.
Like Woven Roots down in Jerringham?
If they are employing farm workers, they are
Okay.
not owners, they are not family of owners, they are
Okay.
not managers of the farm. They are just
People that come in to
hired.
do this to.
Right, they
harvest.
could be permanent employees, but they're employees.
Okay,
And it's a $600 payment off, no restrictions on what you use it for.
$600 payment to the worker or
To the worker,
to the worker.
to the worker, no strings attached as to how it's
Per
spent
worker.
per worker.
Does it
Has
have to, does it have
Berkshire
to,
grown? I mean, they seem to have. a
I'm
network.
just telling you, this is available. If you
Okay.
know of anybody who thinks they may have somebody interested or qualified,
Mhm.
let me know.
Okay,
Okay, somebody said Bartlett's Orchard, may
Yeah, that's what I
employ
was thinking.
seasonal.
I want farm maybe?
it's not Bartlett's,
Oh,
what's
yeah.
the other one in that
oh,
town?
yes.
Bartlett,
Island Farm would be a
Yeah.
good one.
Uh,
So would Peter Salonetti.
Hilltop Orchard does have, yeah.
Okay, so anybody you know
Mhm.
who may feel they have qualified employees, they should let me know.
Okay.
And we'll take it from there. This program is gonna run for 2 years, so you don't have to worry about it tomorrow. And it is a program that runs from Maine, this aggregate of states, Maine down through Ohio and Pennsylvania, I think is the catchment area. So that if you've got workers that are migrating from one farm picking cherries in Maine and blueberries and whatever, or the other way around, the system will understand that there's been one payment to that person and they won't be qualified for another.
So the chain of contact is through you
At this point,
at
yes,
this point. So
Yeah.
is there any kind of publicizing of this?
there
that
will
you're
be
doing?
once the regs are sufficiently, the grant was just announced. And it will end up paying something like 37,000 farm workers
Wow.
in that whole region. The Department of Agriculture has never done anything like this in the past. So it's taking several meetings to get all of the processes in place and the registration of the individuals and so forth. I think Vim is the only holder in Massachusetts of a slot in there. And we're not limited to the number of farmers that we bring into the program. It isn't that we've got 12 or 50, it's whatever, whoever sort of first come. But as I said, there's something like 37,000 slots in this whole grant. It's huge. It's being run by an organization called PASA, P-A-S-A, which I can't remember what the name is at this point, but a very well organized group of people.
Are they gonna have to show their documentation status to be eligible?
Absolutely not.
I was gonna ask, I was just gonna
Absolutely
ask.
not.
Kelly.
And it's not gonna be, put themselves at risk?
Correct.
Okay.
Nothing will be retained, nothing will go to the feds. No, very adamant, we refuse to participate unless that was made crystal clear.
Excellent.
Yeah, no, there is no requirement for that and no tracking.
But for locally Vim, would have to take the application and do the processing?
Yes and no, but it is through us.
Okay, so you take a name and then you pass it on as.
Yeah, I'm not
okay.
sure yet,
Oh,
because
okay.
we're still working, we and PASA are still.
Just so
working
that it
out.
doesn't get to be too much of a burden for them, because them already has
Right.
more
Well,
than they need
fortunately-
to.
Fortunately, we also get a monthly stipend for this work.
Great, okay,
So, and they
good,
were very clear that they understood it was gonna take some effort to
good,
do
Thank
it.
you.
Good.
So,
great.
Two quick things. Can eventually we have a flyer so we can just
Absolutely.
give it and then when you're ready, let's talk about having our PR person do an announcement with them.
Oh, great, right,
Great.
great, thank you.
Who's our PR person?
Great Barrington's.
Oh.
I was gonna say, I think you're all looking at it.
Right.
I have a slot Sunday afternoon that I'll work.
I'd let Jane's head be above everyone else's.
Okay. The cannabis question is an interesting one. I'll have to raise that. Good, and that, the parking lot is still full. We're gonna leave the review draft articles in there. We have no citizens. Upcoming events are listed here. Was there anyone else who had a community comment? I'm happy to hear it. Sorry. So the housing code training, it's online. You need to register for that. The fall dinner, I certainly hope to get there with PFAS, become an interesting topic. And what are these quarterly meetings worth attending?
Yeah, well, this
Well,
one certainly is.
This one might be, the thought is to have food inspection, so like learning how to do sushi rice. And actually have someone there walking you through it, so it's gonna be like a station situation, you know, how to
So
use.
these are in person.
These are in person, yeah. So, I don't know if that's gonna,
Okay, I mean, they're just, I get notices from them all the time.
Right.
some of them are, if they're very interesting, and maybe we could have a delegation from Berkshire County going. I oftentimes have to go to them because I'm on the board.
Mhm.
So I go to probably 2 a year, and I'm happy to carpool with anyone who's interested. It ends up being a long day, but everyone's in the same boat, and sometimes they have some really great speakers.
Okay,
Are these taking the place of the quarterly DPH meetings that used to happen?
No,
Those are still theoretically.
they're in addition to that MHOA.
I haven't heard about one since pre-pandemic.
Maybe,
It used to be in Northampton.
yeah,
right?
Yeah.
Yeah, anyway.
there, I'll look and see, maybe
Nice
you got
to
kicked
get
off
out there,
the mailing
somebody
list or
else.
something.
I thought the DPH Northampton office closed.
Yes, they did.
Yeah.
They're in Westfield now.
okay, anything else? It sounds like there's a riot in the hallway. I'm not sure what we want to do now.
Other loud
Loud voices.
Join the party.
Right. Okay, if
December
there's
9th.
nothing else, the December 9th meeting. I would entertain a motion to adjourn.
So moved.
Second.
Okay, I'm always good for that one.
Just put our two names in.
That's right. Thank you.